Hello and welcome to Immune Resilience in Practice, addressing gluten sensitivity and gut integrity. My name is Adair Anderson. I'm the product marketing educator at Vibrant Wellness. I'm also a registered and licensed dietitian with a private practice called Eating with Integrity, where I resolve functional gut disorders like IBS. I earned an undergraduate degree in biochemistry and a master's degree in clinical nutrition from Bastyr University. Here's our agenda. First, we'll review the importance of immune resilience and its connection to gut health. We'll explore the gut-immune interface with images, graphics, and analogies. Next, I'll share several studies showing the mechanisms of action behind intestinal permeability. We'll talk about permeability testing, and I'll introduce you to Vibrant's Wheat Zoomer test and include the Vibrant Advantage. We'll end with a summary, so be sure to stick around until the end. Immune resilience is important because we want to be able to react quickly and respond to trauma and/or injury and pathogen invasion. However, we want inflammation to have a beginning, a middle, and an end. We want inflammation to resolve. What we don't want is the never-ending low-grade inflammation that contributes to chronic disease. We also want to react appropriately and respond to the correct threats, i.e. pathogens and not self. We don't want to attack our own body cells through autoimmunity. In other words, healthy immunity is detective and defensive, identifying potentially threatening molecular structures and microbes in food, and mounting responses appropriate to the level of threat. Healthy immunity is also internally regulated, meaning tightly controlled and actively resolved. Immunity is also restorative, meaning all damage is repaired, and also tolerant, meaning the immune system is actively unresponsive to self-antigens, food antigens, environmental antigens, as well as commensal microbes. If this year's Immune APM is the same as last year, you probably heard Dr. Robert Roundtree say that gut barrier integrity is essential for immune resilience. He may have also shared the Robert Frost quote, "Good fences make good neighbors." On a related side note, here's a picture of me and Dr. Roundtree at the 2024 IFM Annual International Conference hosted in Las Vegas, Nevada. Look how excited I was to meet him. For those who weren't there, the theme was what happens in Vegas stays in Vegas, but what happens in the gut does not necessarily stay in the gut. We know that 70% of our immune cells are in the gut-associated lymphoid tissue, or GALT for short. And this is on purpose. The GALT monitors luminal contents and plays a key role in immune resilience. There are actually specialized structures in the gut known as Peyer's patches that actually take up microbes. They reach up and allow microbes to transit into the population of immune cells in a very controlled way so that the set of immune cells becomes educated as to what microbes are located just on the other side of that barrier. The image on the screen is from the article Mechanisms of Oral Tolerance. In addition to the Peyer's patches on the right, notice the transcellular and paracellular mechanisms outlined on the left. If we pretend my hands are enterocytes, paracellular means between the cells, and transcellular means through the cells themselves. The gut barrier is a semi-permeable membrane. On one hand, we want to be able to absorb nutrients, vitamins, minerals, amino acids. On the other hand, we need to be able to keep out bacteria, toxins, and things we don't want in the body. So you want your gut barrier to be like nylons, not fishnet tight. Another key point is that the permeability can get dialed up or dialed down depending on environmental stimuli. Dr. Alessio Fasano was the first to discover a mechanism by which permeability increases through his study of childhood diarrheal diseases. Basically, he found that when children had diarrheal diseases, this compound zonulin was floating around, and it was zonulin that told the tight junctions effectively to open up, allowing liquids to get into the gut lumen, causing the diarrhea and flushing out the microorganisms. In fact, one of his first conclusions was that, quote, zonulin-driven opening of the paracellular pathway, so again, in between the cells, may represent a defensive mechanism which flushes out microorganisms, contributing to the innate immune response of the host against bacterial colonization of the small intestine. It's a pretty cool discovery. If you haven't seen this illustration of the zonulin mechanism of action, I highly recommend checking out this article. So just to go over it briefly, in their normal resting state, tight junctions are held together by specific protein interactions to keep the gut barrier intact. However, when zonulin is released, it triggers a signaling pathway that leads to changes in the structure of these tight junctions, specifically a rearrangement of the actin filaments that pulls the cells apart, while also disengaging that protein zonulin occludins, or ZO1, from the tight junction complex. These changes temporarily loosen the tight junctions, making the barrier more permeable. However, once the zonulin signal stops, the tight junctions return to their normal sealed state. Another thing about this article is that it highlights bacteria and gluten as the two intestinal stimuli that can trigger zonulin release. 8 years later, in this 2020 review article titled "All Disease Begins in the Leaky Gut," Dr. Fasano affirms the most powerful triggers for zonulin release are indeed LPS bacteria and gluten. My favorite line in this whole study is, gluten triggers zonulin release through the CXCR3 receptor, suggesting that gluten is misinterpreted by the zonulin pathway as a potential harmful component of a microorganism. So we know that LPS, lipopolysaccharide from gram-negative bacteria, is an endotoxin, right? It's a PAMP, a pathogen-associated molecular pattern. What this article is saying, though, is that gluten, the immune system interprets gluten the same way it does LPS, as a potential harmful microorganism, and will respond the same way by opening up those tight junctions. Okay, returning to the main topic of immune resilience. When we have intestinal hyperpermeability, the immune cells get activated too much and too often. And it's really a vicious cycle. For example, gluten, as we know, can increase intestinal permeability in susceptible individuals. And then when your gut is leaky, you can more easily develop sensitivities to all the other foods you're eating, causing the junctions to open up more frequently and stay open for longer periods of time. All of which, again, is just going to drive that systemic inflammation and contribute to systemic inflammatory conditions, including autoimmune conditions like Hashimoto's thyroiditis and rheumatoid arthritis. In other words, it's an upregulation of the immune system that is less tolerant, more reactive, and less likely to resolve. This chicken or egg concept was repeated multiple times during the GI APM I took last September. For example, it could be poor digestion and absorption, resulting in increased food for dysbiotic microbes, leading to an increased level of LPS in the gut, which of course is going to increase permeability, resulting in increased mucosal inflammation. But that's not the only root cause of intestinal hyperpermeability. It could be the maldigested food antigens themselves creating this local inflammation, or it could be a bout of gastroenteritis that caused the dysbiosis, increasing the intestinal permeability, leading to the start of the food allergies, or it could be the poor digestion and absorption itself, causing nutrient deficiencies or insufficiencies that are preventing the barrier from healing. Indeed, there are many drivers of gut or gut inflammation. You could have adverse food reactions, medications, toxins, lifestyle choices like alcohol intake that all cause that gut inflammation, which then results in increased intestinal permeability, which drives systemic inflammation. Or you could just have the maldigested, malabsorbed foods themselves, resulting in increased gut inflammation, or poor gut healing, resulting in increased intestinal permeability, fueling that systemic inflammation. Or it could be dysbiosis and its metabolites, like gastroenteritis, someone getting foodborne illness. All of these things are going to drive intestinal hyperpermeability, and once you have intestinal hyperpermeability, that's going to drive systemic inflammatory conditions. So in summary, when someone has intestinal hyperpermeability, it's really hard to identify that root cause. It could be any one of these things driving something else, which is why testing and not guessing is crucial to confirm, first of all, that the patient has intestinal hyperpermeability, and then to investigate mediators and factors that are preventing healing from taking place. So how do we evaluate gut integrity? How do we measure the level of intestinal permeability? Well, the lactulose-mannitol test has been around for a long time, and it does measure paracellular and transcellular permeability. Here's how. The water-soluble monosaccharide mannitol is pretty small, so it passes through the intestinal mucosa predominantly through transcellular uptake, meaning it goes through the cells themselves because it's little. whereas the larger disaccharide lactulose diffuses paracellularly, or between the cells that are usually held back, and is usually held back by tight junctions. So when mannitol is high, that's normal, right? We're going to see some transcellular permeability there. However, when lactulose is high, that indicates increased intestinal permeability because it's getting through between the cells paracellularly. And when both are low, that's when you can suspect malabsorption, typically from damage to the brush border, preventing that mannitol from passing transcellularly. And when mannitol is low, but lactulose is high, then you can suspect both increased intestinal permeability and malabsorption together. Unfortunately, as I learned during the GI APM last fall, the lactulose-mannitol test has low sensitivity and specificity, meaning there's often false negatives and false positives. In contrast, Vibrant's Wheat-Zoomer includes an intestinal permeability panel that measures antibodies to zonulin, actin, and LPS with high sensitivity and specificity. Anti-zonulin provides insights into that paracellular permeability. For example, this patient has elevated levels of antizonulin IgA, plus their levels of antizonulin IgG is more than twice the reference range. So when a patient has antibodies to zonulin, it's evidence that this patient has had chronically elevated zonulin. Anti-actin is going to provide insights into the transcellular permeability. And remember, actin is the thing that's pulling the cells apart, so it's inside the cell. For example, this patient has moderately elevated levels of IgG to actin, indicating the intestinal epithelial cells themselves are moderately leaky. Anti-LPS provides insights into whether dysbiosis is driving intestinal hyperpermeability. This patient's level of IgM plus IgG antibodies to LPS is quite high, which does provide evidence of dysbiosis, specifically that there's overgrowth of gram-negative LPS bacteria in the gut, which is likely contributing to their increased intestinal permeability. At this point, you might have noticed that zonulin itself on this slide is normal, and you may be wondering, how can zonulin be normal when antizonulin is elevated? The answer is that zonulin is just a snapshot in time. We often see normal zonulin when the patient is fasting at the time of blood sample collection. And this is because nothing is currently irritating the gut when you're fasting, right? No adverse food reactions happen during fasting, and nothing is feeding the LPS bacteria, causing them to shed more LPS. Zonulin, well, you can think of it like your heart rate or your blood pressure. It's going to fluctuate throughout the day based on responses to dietary and environmental triggers. While zonulin itself is a snapshot in time, the antizonulin marker is like a report card. It's indicating how often zonulin has been elevated over the past week or months. So this is a great time to think about the half-life of immunoglobulins. So the half-life of immunoglobulin G is 21 to 23 days, so it represents approximately the past month of immune reactivity. In contrast, IgA's half-life is only 6 to 8 days, so provides insight on exposure within the past week or so. And again, Vibrant includes both IgG and IgA on the test, so you can know short-term and long-term exposure. In addition to high-accuracy intestinal permeability markers, zonulin, actin, and LPS, Vibrant's Wheat-Zoomer also measures wheat and gluten sensitivity and provides early and sensitive detection of markers associated with celiac disease. Well, we know that anti-LPS provides evidence of dysbiosis, and we know that bacteria are powerful triggers of zonulin release and increased intestinal permeability. However, we also know that from Dr. Fasano's work that gluten is also a powerful trigger of zonulin release. So let's look into those markers next. Gluten is a superprotein complex made up of gliadin and glutenin. Gliadin tends to be the more reactive portion of gluten for most people, and Vibrant's gliadin panel measures reactivity to all 4 forms of gliadin: alpha-gliadin, alpha-beta-gliadin, gamma-gliadin, and omega-gliadin. Glutenin, on the other hand, is the other part of gluten. Reactivity does tend to be a little bit less common, but some people can have reactivity to glutenin with or without reactivity to gliadin. Vibrant's glutenin panel looks at the full spectrum of reactivity to glutenin from high molecular weight to low molecular weight. So high molecular weight glutenin is associated with atopic dermatitis, asthma, and wheat sensitivity, whereas low molecular weight is associated with wheat sensitivity, asthma, atopic dermatitis, urticaria, and anaphylaxis. So here's where we want to point out that a reaction to any one of these 6 peptides indicates gluten sensitivity. Let's do an analogy now. So imagine you have a sister who has 6 kids, and 5 of those kids are absolute angels. You love them. They're super polite, always fun to be around. But she has that one kid who is an absolute terror. Comes into your house, running, screaming, throwing fits, breaking things. And the thing is, every time your sister comes over, she's going to bring all 6 kids. So even if you're only annoyed by one of them, you should still just avoid gluten. In other words, every time you eat gluten, it's going to break down into all 6 components. So no matter if you're only reactive to one or all 6, it indicates a gluten-free diet would be therapeutic for you. Vibrant's wheat tumor also includes a non-gluten wheat panel, which measures reactivity to the non-gluten peptides found in wheat. While 75% of the peptides in wheat are gluten, 25% of these are non-gluten wheat peptides, and you can also be reactive to them. These non-gluten proteins cause inflammation due to a wheat sensitivity, and in fact, some people are more reactive to the wheat proteins themselves than to gluten. Another clinical pearl here is that when someone is reactive to this panel, they're often likely reactive to other grains as well, especially corn. So if you're going to be taking someone off wheat and gluten, it's also helpful to run a grain zoomer and a corn zoomer to make sure they're not replacing one sensitive food for another. 3 more markers you may not be familiar with are wheat germ agglutinin and transglutaminase 3 and 6. Wheat germ agglutinin is the lectin component of wheat. Lectins can facilitate the translocation of bacterial endotoxins across the epithelial barrier, so antibodies to wheat germ agglutinin can indicate intestinal hyperpermeability because lectin from wheat can actually help endotoxins cross the barrier of the intestinal lining. A clinical pearl here is that wheat germ agglutinin can compete with vitamin D for absorption, so you may see vitamin D low on a micronutrient test when a patient is reactive to wheat germ agglutinin. The transglutaminase panel indicates gluten-mediated autoimmunity. Now, these are markers for autoimmune reactions to gluten that aren't celiac disease, similar but not quite the same. While gluten is still the trigger for these reactions, they manifest differently than traditional celiac and may not manifest symptomatically in the GI tract at all. Transglutaminase 3 is associated with skin manifestations of autoimmunity like eczema and psoriasis, whereas transglutaminase 6 is associated with neurological manifestations of autoimmunity in the cerebellum, such as gluten ataxia, brain fog, anxiety, and depression. Last but not least, Vibrant's wheat tumor also includes traditional biomarkers for celiac disease, tissue transglutaminase 2, or TTG, and deaminated gliadin peptide, or DGP. In addition to TTG and DGP, Vibrant also includes the fusion peptide. This is where TTG is cross-linked to DGP, and it's a biomarker that allows for an earlier window for celiac disease initiation and diagnosis. In other words, it can identify celiac disease progression anywhere from 14 months to 4 years earlier than traditional lab markers. And it really helps answer the question, is this patient on the road to developing celiac disease? If you've never heard of the fusion peptide and are feeling skeptical, please allow me to share some research published in 2019 in conjunction with the Mayo Clinic's Dr. Joseph Murray. The paper is called Synthetic Neoepitopes of the Transglutaminase Deaminated Gliadin Complex as Biomarkers for Diagnosing and Monitoring Celiac Disease. The study identifies Vibrant Sciences as the owner of the Microarray platform used to estimate antibody binding intensity of that tissue transglutaminase deaminated gliadin fusion peptide complex. It also references a 2016 study also published by Vibrant and Dr. Murray together, where the peptide array was first described. So let's dive into the peptide array, also called a microarray, and how Vibrant makes the 3-dense microchip used to run the wheat zoomer test and really all of our antibody testing. So first of all, the microarray uses a ELISA methodology. However, instead of 1 antigen per well, we can measure up to 96 antigens per well. Looking at steps 1 through 3 here, this is possible because we attach antigens to silicone semiconductor wafers. This allows us to bulk manufacture thousands of identical chips per wafer, creating the ability to scale to volume at very low cost. By repurposing many of the techniques used by the computer chip manufacturers, we can mimic the advantage seen in the computer industry, significantly improve quality and performance while consistently driving down cost. Looking at step 4, we then dice the wafers into tiny microchips. And in step 5, we use automated machines to arrange the microchips. It's one for each antigen in a 4x4 or 10x10 grid atop a pillar on either a 96 or 24 pillar plate. The pillar plate is then flipped upside down and submerged into the patient's blood sample, allowing for the simultaneous analysis of a large number of analytes from a single blood sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Again, each pillar can measure up to 100 analytes because it's a 10x10 grid. Although there are 4 controls, so really we can measure up to 96 antigens per pillar. Amplified chemiluminescent signals have a high signal-to-noise ratio, which provides high sensitivity, meaning very few false negatives. In summary, this automated process allows for high throughput, sensitive, and specific analysis of multiple biomarkers from minimal sample volumes. It's pretty cool technology. Side note, you can always find the methodology and interpretation report on the introduction page of Vibrant Reports, and I highly recommend reading this page, especially the part where it says, the Vibrant Wheat Zoomer test is a semi-quantitative assay that detects IgG, IgA, IgM, and IgE antibodies in human serum/GBS for wheat antigens with multiplex chemiluminescent immunoassay methodology. And also the part where it explains how the Wheat Zoomer summary score and intestinal permeability score are calculated. Specifically from the patient's IgE, IgA, and IgG reactivity to the antigens, with higher weightage for the IgE than IgA than IgG. And yes, the Wheat Zoomer includes wheat IgE to rule out wheat allergy. And it also includes the Wheat Zoomer score and intestinal permeability score, making it easy for you to track your patient's progress over time. The interpretation of report section also includes information on the reference ranges. Specifically, reference ranges for the Wheat Zoomer have been established for both the pediatric and adult population using 2,000 healthy individuals. And it also goes on to explain that the classification of green denotes a result that is within the normal reference range. The classification of yellow denotes a result that is moderately elevated with respect to the reference range. And the classification of red denotes a result that is elevated with respect to the normal reference range. And note that Vibrant includes the results interpretation key on the first page of the report, right here. The other great thing about Vibrant lab reports is that we offer interpretive comments for all the markers that are outside of the reference range. For example, zonulin acts as the gatekeeper between the cells of the intestinal lining as it considered the mortar that holds the cells together. When intestinal permeability is present, the intestinal lining is compromised, allowing larger protein molecules to get into the bloodstream, thereby causing an immune response. Increased levels of zonulin/antizonulin antibodies indicate the presence of intestinal permeability. Since bacteria can significantly impact intestinal permeability, consider subsequent testing of your gut bacteria profile with Vibrant's Gut Zoomer. This is probably a good time to share that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. In other words, you can keep the interpretation to yourself and only share the markers or the summary with your patients. Vibrant's Wheat Zoomer is a blood test that can be collected via venipuncture or dried blood spot. Fasting is not required, and there are no dietary or medication restrictions. However, as with all antibody testing, patients taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medications may have falsely lower or falsely increased total and specific immunoglobulin results. For this reason, Vibrant recommends adding total immunoglobulins when ordering the Wheat Zoomer. Total immunoglobulins is a free add-on to any Vibrant serum antibody test. As you likely know, serum antibody testing is based on normal functional immunoglobulin production. So when total immunoglobulins are depressed, you're more likely to have false negatives. However, knowing your total IgG or IgA levels can help you mathematically reset the reference ranges, and let me know if you want more information on this. In summary, the total immunoglobulins test assesses a number of immunoglobulins, which is helpful for those with suspected immune function compromise or those undergoing an IV IgG therapy. So, which patients benefit most from Vibrance Wheat Zoomer? Well, patients with suspected gluten or wheat sensitivity, also patients with suspected intestinal hyperpermeability, anyone who has leaky gut. Also, those with gastrointestinal inflammation causing diarrhea or constipation, cramping, nausea, or discomfort after eating. Patients suffering from extraintestinal issues related to leaky gut, like headaches or migraine. Or those with neurological symptoms like memory loss, balance problems, numbness, tingling, or anxiety. And patients presenting with skin rashes, such as dermatitis herpetiformis. Also, patients with autoimmune conditions, including inflammatory bowel disease, type 1 diabetes, rheumatoid arthritis, lupus, Hashimoto's thyroiditis, and Sjogren's. Almost a decade ago, Vibrant published 2 white papers on this topic. The first investigated the overlap between wheat sensitivity and rheumatoid arthritis by evaluating the presence of RA biomarkers in wheat-sensitive individuals and vice versa, using Vibrant's Wheat Zoomer and RA panel respectively. The conclusion was a strong association between the characteristic serological biomarkers for rheumatoid arthritis and wheat-related disorders. The second explored the connection between wheat sensitivity and autoimmune diseases by analyzing the presence of anti-nuclear or ANA and extractable nuclear or ENA antibodies in individuals with wheat-related disorders using Vibrant's Wheat Zoomer and ENA plus ANA panel. The conclusion was that higher proportions of wheat-related disease subjects carry ENA antibodies that are important specific biomarkers of autoimmunity. Therefore, evaluation of autoimmune antibodies is appropriate when existence of an additional autoimmune disease is suspected in patients with wheat-related disorders. Last year, this review article came to a similar conclusion. Specifically, the impairment of the intestinal barrier is referred to as leaky gut or intestinal wall leakage syndrome. This condition, mainly caused by bacterial infections, oxidative stress, alcohol, or chronic allergy exposure and dysbiosis, leads to the development of several pathologic conditions, including obesity, non-alcoholic fatty liver disease, non-alcoholic steatohepatitis, liver cirrhosis, neurodegeneration, cardiovascular diseases, inflammatory bowel disease, celiac disease, irritable bowel syndrome, type 1 diabetes, and several autoimmune conditions. And they also published this lovely figure that I've included in the slide deck. Another great paper, and I recommend reading this one too. Coming full circle back to the topic of immune resilience, this image comes from a 2024 review article titled Increased Intestinal Permeability, an Avenue for the Development of Autoimmune Disease. And this one shows how the increased systemic entry of luminal contents has been associated with the development, progression, and/or relapse of autoimmune diseases such as rheumatoid arthritis. It states, growing evidence suggests that an attenuated gut barrier and increased translocation of luminal components into systemic circulation potentially contributes to the etiology and/or progression of gut-localized and systemic autoimmune diseases. And also mentions that RA patients who follow a gluten-free diet showed reduced antibody levels, had anti-inflammatory effects, and protected against atherosclerosis. So I'd like to talk now about complementary tests, but before we do, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1, if you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2, if you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there is more than one root cause contributing to your symptoms. So in addition to the Wheat Zoomer, consider celiac genetics testing, which includes HLA-DQ2 and HLA-DQ8 gene mutations. This is especially helpful when total serum IgA is normal, tissue transglutaminase IgA is high, but endomysial antibody is negative, in which case you would suspect a false positive TTG. However, a positive HLA-DQ2 or GQ8 would help confirm a true positive TTG. Also, Vibrant's Gut Zoomer. which provides insight on gut diversity via Shannon's and Simpson's index, as well as overgrowth of the gram-negative LPS-producing proteobacteria, which are both cardinal features of dysbiosis. And if you suspect multiple food sensitivities or reactions in your patient, consider other food zoomers like the corn zoomer, grain zoomer, or lectin zoomer. The lectin zoomer, which does assess the body's immune response to lectins, can be especially helpful if the patient's wheat zoomer results showed an increased response to wheat germ agglutinin, the leptin component of wheat. And if your patient is experiencing cognitive symptoms, the NeuroZoomer Plus is a good add-on because leaky gut can be associated with leaky brain. In fact, LPS can actually cross the blood-brain barrier and induce neural inflammation, neural toxicity, and neural autoimmunity. Additionally, tissue transglutaminase 6 is associated with central nervous system development and motor function. And finally, Vibrant's Autoimmune Zoomer, which is a comprehensive panel designed to detect and monitor autoimmune conditions by measuring 63 specific autoantibodies and antigens, including markers of thyroid disease, rheumatoid arthritis, and type 1 diabetes. And on a related note, you can order all these tests directly from the Vibrant Wellness Provider portal. Indeed, Vibrant Wellness has the largest selection of comprehensive specialty lab tests trusted by leading wellness professionals. Here's the first 2 pages of our 6-page test menu. And as you can hopefully see, it includes autoimmune tests, cardiac health, food reactions, food zoomers, gut health, hormones, infections, longevity, nutrients, skincare toxins, and genetic tests. Our extensive test menu helps you get to the root cause of chronic conditions faster by allowing you to test and not guess. Plus, our comprehensive test menu makes it easier for both you and your patients. Our one lab, one box, one-stop shop makes it easier for you because you can order all testing from one provider portal. It's also easier for your patients because all tests are shipped in one box with clear, consistent collection instructions. The Vibrant advantage is that the wheat zoomer uses highly specific and sensitive microarray methodology to measure human immune reactivity to specific antigens that provide early and sensitive detection of celiac disease, a comprehensive assessment of wheat sensitivity, plus insight into that very important intestinal barrier permeability, helping you identify the root cause of chronic inflammatory conditions in your patients. In summary, healthy barriers are the best protection against inflammation and autoimmune disease, and Vibrant's wheat zoomer test provides specific and sensitive detection of intestinal permeability using the markers anti-zonulin, anti-actin, and anti-LPS. And that's it. Thanks for watching. Please let me know if you have any questions.